Number 1 on the agenda, consideration of possible action on receiving a report from Logan County Health Department and Logan County Emergency Management. I lost my spot. To the coronavirus and actions necessary for Logan County. Y'all's up.
I'm gonna let them go first. We have Jan and Brandon from the state health departments here to answer questions. We've been talking numerous times, but they're the experts on this, so I will.
So state or county or both?
County.
County
County
health
County.
department.
Yes.
If I could get state your name and
Sure.
you could just take off.
Sure. I'm Jan Fox, and I'm the regional director for the Logan County Health Department. The Logan County Health Department is now part of a large region of health departments. So I also have Alfalfa, Blaine, Canadian, Garfield, Grant, Major, and Blaine. Did I miss Blaine? I sometimes leave out Blaine. So we have been trying to get around everywhere we can to share factual information about COVID-19. There's a lot of misinformation out there, but there's a lot of good information too. So we're trying to get into as many forums as we can to share what we know to be the facts and then answer questions and things like that. It's important that we not spread fear and that we dispel any kind of misinformation so that people aren't worried, but we do know we need to act to keep the spread down as much as we can in our county. I don't know what all of you all are interested in knowing about COVID-19, but I will say that we don't have any confirmed cases here in Logan County. The health department has been tasked with following up and investigating any positive cases. We do have 2 cases in Canadian County. And when we say we're investigating, what that means is that we are going to the person that's reported to us and we are taking a history, trying to determine where they might have contacted it. So if they have travel or if they have exposure to a known case, that's important information. And then we find out who all they might have been in contact with, so that we can go out, actively find those people and try to get them tested. So that's been the health department's role. We've also been monitoring travelers, and I don't recall whether or not we have travelers that we've monitored here in Logan County. I don't believe we did, but I don't want to be held to that because I'm not exactly sure. But monitoring the travel means that one of our nurses goes either by FaceTime or in person and meets that person outside and takes their temperature and monitors for symptoms. And then, of course, if they develop symptoms, we had been communicating with the EPI at the state health department to determine if we can get a test for that person. So that's been our role so far. And then, of course, sharing information. Things are changing really rapidly. Each day we have a new set of information that we are trying to assimilate and to share. So what we learned yesterday was that Logan County, so there's been a national, actually a global, no, it's a national shortage of viral testing medium. And so that is one reason that the tests have been so hard to come by. All the manufacturers in the United States that produce that viral testing medium, which is required by all the labs that do this particular test, they have not been able to keep up with the demand for it. And so prior to this week, if someone needed a test, the physician who wanted to test them had to get approval through the EPI on call at the state health department. Or a physician could have, there were private labs, some private labs that were providing that testing. The difference is that the private labs was a cost. I don't know what the cost was, but the testing through the state health department was free. What changed over the weekend was that the state health department made a decision that they would no longer be that final decision maker on who the physicians could test. It's up to the clinician now to determine if they're going to test. But the problem is the shortage of testing. So we're still requesting that the clinicians be very, very cautious in who they test. To give you a picture of how short we are on the testing, we learned yesterday that Logan County will receive, the county health department will be able to collect swabs for the test, but we're only getting 20 tests in Logan County. So we have very, very strict criteria that we're going to have to abide by. And so what we're going to do at the county health department is we're going to ask that we're basically going to limit our collection of swabs to 2 groups. One that's recommended by a physician who doesn't have the ability to collect the specimens themselves. Plus, then the person has to meet, there's a lengthy criteria that we have set out. If they meet that, then we'll do that test. And then secondly, if it's contacts to a known case or someone that we have clear reason to believe that they might have been exposed to COVID-19, we'll test them. Our 20 tests are going to go fast, I believe. So that's the situation. It sounds very dire as far as the testing goes, but one thing that I'm really trying to caution everybody to remember, there's no treatment for COVID-19. So testing in that situation isn't as important because the physician isn't going to change what he's doing for you on your treatment based on a positive test unless you're very ill. It's helpful for us in public health to know where the disease is and how it's spreading and some surveillance type of information. It's really helpful for us to have testing ability. And it's helpful if someone's really, really sick. But for the average person, it's not going to make a difference in how their physician is treating them. So that's something that I've really been trying to stress. Let me think if there's anything else important. There has been a shortage of personal protective equipment as well, and that's due to the global nature of this and panic, I think, about needing personal protective equipment. So that's been a little bit of a challenge for emergency responders and hospitals and clinicians to have what they need to protect themselves. I do understand that the state of Oklahoma has received some personal protective equipment. That yesterday I was told that the state health department was working on a plan of how to distribute that and make sure that it goes to those that need it the most. And I didn't hear anything about those decisions, but I think that's what they've been working on. The only last thing that I would say, there's been a lot of, I personally had a hard time wrapping my head around why the fuss about COVID-19, because it's really been compared to the flu. And that's true, it is in some ways like the flu, but then in other ways it's different. So the way that I'm kind of looking at it is the flu, they present similarly with a cough and fever and upper respiratory type of issues. But they're different in that, in other ways, such as the flu spreads a little more quickly. This is a little slow, just a little bit slower to spread. But they both cause mostly a mild to moderate illness. Most people don't develop a severe illness. But COVID-19 is probably looks as if it's a little more likely to cause severe illness than flu is. So the concern around this particular virus is not so much how sick people are going to get, but the fact that there's not any immunity out there, there's no vaccine, And, you know, it's new, it's novel, so people may or don't have an immunity. So the concern is that even though it spreads at the rate slower than influenza, that many people will get it because there's not any immunity out there and no vaccine. And many people could get sick just based on percentages and likelihood of getting very sick, and that could overwhelm the medical system. So that's really where the concern is and why we need to take action. We don't need to be panicked and we don't need to worry, but we do need to take action and be proactive, and I think that's what we're doing. So that's kind of it for what I wanted to say. I'd be glad to answer any questions that I can. We don't have all the answers, it's new, and we're just learning about it, but I can definitely try to answer any questions that you have.
So you don't think the government's panicking by shutting down everything?
So what we're trying to do, I'm trying to decide how to best describe it. What we're hoping to do is limit the number of cases, because the fewer people that have it, the fewer people there are to spread it around. So I'm not going to say that there's not any panic occurring, but I do think that it's important that we do act. And I think it's important that we do have social distancing. This could be like SARS. SARS, when it went around, it was a coronavirus, and it went from January to July, and then it burned out. But MERS didn't do that. That was another similar virus, and it is still endemic. And we still have this concern that we want to not have what happened in China and in Italy, where the medical system is just overrun. So it is important that we do take action and limit the spread to the degree that we can. And that's my opinion.
Thank you.
Yeah.
So do you see any actions that we can do to help this cause? I mean, for the county, I mean, in our offices, what do we need to do you think?
Well, Brandon and I have come with just some information about what some of the other counties are doing that could be helpful to you to understand.
Yeah, so there's been several counties so far across the state that have either closed down their courthouse to the public and still, you know, staff is still there working. Some have it open to the public, but they are actively taking temperatures at the door. So if you're running a fever, they're not letting you in. And then some are just normal business, you know, business as usual. It's kind of how you guys want to proceed forward with that, you know, because we don't want to tell you guys what to do. It's just, all I can tell you is so far we have no cases in Logan County.
Have you done any testing in Logan County?
No, I am not aware of any that have
The
been
health
done. I don't.
department hasn't. I do believe private physicians have. So there have been people who've been tested, I'm sure. I don't have numbers or anything like that, but we haven't had any positive.
Yeah, that's the big.
Does Mercy have testing? Do you know?
I'm sure that they
Some of the
do have
testing,
access
some of the hospitals have
to
testing.
private labs, yes. And if they, you know, if they had a person that met criteria, they could have had it tested through the state health department.
So the whole idea then is if you think you meet the criteria, then you need to get hold of a health department and people.
Yep.
And they will determine whether you meet that criteria, and then a test hopefully will be available to ascertain the same. How long a turnover in the results?
Well, we were told that the results would be up to 48 hours, so pretty quickly. However, I heard yesterday that it was taking maybe 72 hours because they had such an influx of testing to do. But it's pretty quick.
So no weeks worth.
Yeah.
No, it's
Okay.
normally within 3 days. We'll get results back.
Yeah.
And that might be sped up, I think, from what I understand, they may be coming up with
We're
some
trying to come up with
quicker
some
turnover.
rapid tests and some things like that. They don't have them yet.
It also helps as more labs open and are
Mhm.
able to do testing, you know,
Right.
we can spread those out a little bit more and it's not just all in one.
Good.
The manufacturer
laboratory.
could come up with the testing medium that's needed. But the recommendation has been made by CDC that we limit public gatherings of 10 or more. That recommendation has come out. So,
Yeah, I was gonna
we're
say,
in
don't
violation
count
of
how many
that.
people are in here, please.
Yeah, CO2 in the room's getting a little high too.
Yeah.
It's just, we just want to stress that if you guys do talk to the public or you guys do put anything out, to make sure that anybody who thinks that they have symptoms or could possibly be positive, to call ahead to their primary care physician or call the state 1-800 number.
Yes.
Mhm.
What is
That
that
way
number?
they're not just, we have it, that way they're not just randomly showing up to their doctors or to a hospital, because the last thing we want is for them to go in and be positive and go in and get a bunch of people who are already sick, give them corona, and then, you know, they're the most at-risk people, you know, the elderly or those who are already sick or with a pre-existing condition. So we just, you know, call ahead, because a lot of places are implementing drive-through testing, so they'll come meet you out roadside, or they will have you come in a separate entrance or keep you separate from the general, you know, people that are there.
Is there a planned drive-through testing for Guthrie area?
Not yet, they're working on
We're
it.
only going to have 20.
Yeah,
So what we're
At this
likely
time.
going to do is drive through in that we're probably not going to take the patient, if the weather permits, we won't probably take the patients in the health department. We'll probably meet them in the parking lot. As long as we can maintain confidentiality, that would be better, because it just makes it easier if we don't have to bring them into the health department. So that's our version of drive-through testing.
Yeah.
Does any other county officers get any questions for me?
I have a comment. My grandson had type A flu
Mhm.
about 10 days ago,
Mhm.
and then he got worse, and so they took him back to the doctor, and he now has pneumonia. And they said there wasn't any need to test him at this point, and it's $3,000 for the test, and their insurance didn't cover it. And they're treating him for pneumonia and everything. And there's 2 cases that just became in Oklahoma County just a couple of days ago, and that was at Kelly and Waterloo at Oak Tree. My kids are builders, and they know the people out there that have it. So it is very close, you know, those 2 were at Kelly and Waterloo.
Yeah.
And I just wanted to tell everybody how expensive those tests are.
Yeah, that's good to know. I wasn't sure what the cost was, but so I'm glad to know what it is. Very expensive.
It is.
Yeah.
I have a question. So
Sure.
it's quite
and
possible
there's the website.
with the shortage of the
They'll send you
testing
information.
and people that are exhibiting symptoms, if they're in a lower risk category, then they won't get tested at all.
That's right.
So it's quite possible that it is in Logan County, we just don't
Yes.
know it.
Yes.
That's
The web
right.
address?
possible.
It is, yes.
All right, we'll go to
I just,
Yeah, no, you're
not
right.
creating any panic,
No.
I mean, it's just the reality of the
It's the
situation.
reality, and that's what I really am trying to just provide the picture of really what's occurring. Taking temperatures at the door is helpful, because you definitely don't want somebody with a fever coming in. But it really could be that you can shed virus before you develop symptoms.
Right.
And that makes it a virus really hard to contain when that's the situation. Although it is helpful to take temperatures, I'm not saying that's not, but it's just that it can be contagious before the symptoms start.
Thank you.
Yeah.
All right, thank you. Brandon, the newspaper would like to know your name.
What's your last name? My name is Brandon Fetters, Fetters.
Thank you.
Not a problem.
All right, thanks for the update.
Sure.
Appreciate it.
I appreciate you all asking us to come.
Good, thanks for being here. Item 2, consideration and possible action on receiving a report from sheriff, county treasurer, county assessor, county court clerk, county clerk on availability online services and where would I go? May be put in place to reduce walk-in traffic. You're up, Sheriff.
I'm waiting for that.
Go filter it.
Well, this is, I just put that in my mouth.
All rise.
This is kind of an outline of our plan.
Thanks, sir.
Several things we're doing, obviously with our inmate population, that's a main concern for us. You know, a couple things we put in place. We're currently allowing no face-to-face visitation or kiosk visitation inside of our office, trying to limit exposure to our facility as well as those that may be visiting. I mean, all classes, AA, NA, church have been suspended in our facility. When we're booking in our inmates, we have a coronavirus screening process where we do take their temperature and ask a pretty lengthy list of questions. Should we have somebody that we suspect may have the virus, we have means of quarantining them in our facility. Our healthcare provider turnkeys staying up on the latest stuff as well. We have every book-in that comes in, we do separate them, and then our nurse will do a more thorough assessment of that inmate. If we do have inmates that do test positive, we have a quarantine pod that we can place them in. Of course, under the care of our healthcare provider. And we're also evaluating our arrests and warrants to see, you know, we're basically establishing a priority on who's going to be in our facility and who's not going to be in our facility. As far as the sanitation of the office, we've got, you know, trustees as well as staff that are sanitizing common areas. We provided cleaning supplies to all of our pods for sanitation and cleaning. We've currently suspended all of our SDA gun permit processing and any type of fingerprints because they actually have to go into the detention center for that. We're still responding to calls. If we can handle a call over the phone, take a report over the phone, that's what we would prefer. But if somebody calls us and wants us to come to their house, we will come to their house. Of course, we're still out patrolling. You know, and we're monitoring our staff. You know, if we get somebody that we suspect is getting sick, we send them home. And as the lady from the health department said, we're monitoring this daily. As I was writing this, things were coming down the pike that changes a few things. And our goal is to evaluate our procedures daily and in 30 days have a revisit of everything to see if we can start allowing some of that stuff back in. So, I mean, that's pretty much it from the sheriff's office. You guys got any questions?
Seems like prudent measures to me.
Yeah, it's going to be an inconvenience for a while, no doubt about it.
That's the way it is. Sherry, you got anything?
Well, I have online payments, so people can still pay their taxes online through the mail, and we have a drop box out front that we check every morning, so payments can still be made. I have given a 30-day extension on second half payments. They're not due till April 30th. The second half payments went out Monday for their notices. So they actually have until May 15th to pay the second half with no penalty. So all the payments can still go as needed. We don't have a lot of high traffic right now. We have maybe 2 or 3 people come in the office a day, and they're usually not together. We have been, you know, wiping everything down after every customer. Of course, when we take in cash and stuff, you know, we're, you know, being real diligent about, you know, hand sanitizer and washing our hands. So we may do a deal where we're not taking cash payments, but they could go get a money order and put it in the drop box if we need to do that. There's a couple of things, I can work completely from home, but there's a couple of things we can't. Our mortgages are one thing, because you have to stamp the original documents. However, Jeremy from the Abstract Company is one person that brings them. He's just one person. So I think we can still continue that as well. Of course, me and Troy have to get together about that, but I think we can still do that. I've contacted the dealerships because we sell the motor vehicle stamps, and I have to give them to them. John Vance has bought up stamps for the next 3 months. We're gonna get hold of our other dealers to let them know, hey, if you wanna go ahead and buy some stamps so that you have them on hand. Other than that, the 936Rs for mobile homes is a cash transaction only, and we have to actually sign paperwork, original documents. That's another thing that would have to be done. So maybe just limiting how many people come in the courthouse at one time or in the office at one time, but I don't have a high traffic right now. So we can probably still do business as normal. And just
Alright.
keep it at a minimum, and we could run a skeleton crew if we had to. We could have, I mean, I only have 3 people in the office, 3 to 4 counting me, but we could do 2 if we needed to, so.
Alrighty, thank you. County assessor.
I received email from a lot of the assessors telling what they're doing. And they're shutting down their courthouses and their offices to the public and working this way. The Oklahoma Tax Commission shut down and they're all working from home. I have, the 936Rs is the only thing that we would have to have contact, and we're trying to figure out a way not to do that, if they could use a money order or what were you telling me?
It is cash only, unless, what, Sherry, a cashier's check from the
Money
bank?
order, cashier's.
Yeah.
Oh, are you talking about the 936
Yeah.
hours? Yes, we can do a cashier's check from the bank, because that's like guaranteed money. And the only reason is because it goes in my trust account, and we
Right.
sign off on it saying that we are testifying that those taxes are paid and it's prepaid for the next year. So
that's something they could mail in. As
yeah,
a
they
cashier's
can
check.
mail it in, or they could use, I mean, we've got the Dropbox, or if we just limit to how many people are in the office or in the courthouse at one time.
Yeah.
And we can do that. The most traffic is from your courts, it's not from my office or the assessor's office.
We get we get quite a bit of traffic though.
But
So
now
we're
that,
open.
but also the good thing is protest period's over,
Yeah.
exemptions are over. I only mailed out, with second half payments, I only mailed out 3,000. That's nothing compared to the 25, 30,000 that I mailed out the first half. So 3,000 is not that much. I'm getting a lot of online payments. I can take payments over the phone. If someone doesn't have access to the internet, I can take a payment over the phone if we need to. So we can do that.
What are you calling this, a 936?
936R, it's when you have to move a mobile home, buy or sell a mobile home. It has a title like a car, so they have to come to the assessor, they start the paperwork, the assessor brings them over, they pay me prepaid 2020 taxes. I sign off on it saying that those taxes are paid, because once they move that mobile home, it's gone out of our county. So they have to prepay them, it goes into trust, and it stays there until the 2020 taxes come out. When they do, I take the money out of the trust and then therefore pay those taxes. After they leave my office, they have to go to the tag office and file the paperwork, just like if you're filing your car title. So, and they get permits from us to give to the mover. They have to, that mover has to have that permit on them to move the mobile home. So we may, and it may be something where we need to suspend 936Rs, I don't know, because they have to go to multiple places to get this done. So depending on if the tag offices stay open, they would have to do that.
On average, how many you have a month?
And we have a lot. I don't know the number, but we have,
I mean, just a guess.
you may have
I
25,
oh no
30, think more?
a month.
Mm-hmm.
No, I think it depends on the time of year.
Yeah, it
but
just depends on the time
You
of year
know.
too.
For this time of year, I guess, is what I'm
Pretty
asking.
low.
It's a little unpredictable.
1 month you'll have an influx, you'll have a whole bunch, and then
Give them.
I mean 10 maybe.
Yeah.
But we have had as many as
It's
25,
20,
you know.
yeah, you just never know,
So really not a whole lot of foot traffic due to that.
All those people are not coming in on the same day.
Right.
You know what I'm saying, or at one time. Like I said, if you have someone at the front door kind of monitoring how many people are coming in the courthouse.
Yeah.
Back to the assessors for a minute. We put in place, I've talked with all my people, I'm gonna allow some of them to work remotely. The deeds ladies, because she can get the deeds online and work at home, and our programmer, the person that wrote our software, can send them something at home with a password to be able to connect up here to what we do. My field people are going to continue what we have right now is to work, because they're not actually talking or meeting with people. They're measuring new houses, or they're going to do visual inspection where we don't go in anyway. I wanted to be able to, and I've talked to Lowell about this, to be able to, this is what I would like to do, is to be able to lock our office from the public and have a skeleton crew working to protect them in the office, because we have to have somebody in the office unless the whole county shuts down, to answer the phone, to get the mail, and make things going. But we're able to conduct our business preferably without the public in there. I'm at
I
high
just don't
risk.
think we ought to lock a public building. I mean, the public's who pays it, so I just don't
I
think we ought to
agree.
lock the door.
I agree. We
Okay,
shouldn't lock them.
well, I'm
That's
not
my
making the
opinion.
decisions,
Making
I'm just giving
distances.
suggestions. So what we'll do then, if we're not gonna do that, is we'll continue business as usual with the skeleton crew in there, and most of us work, or some of us working from home. The others will still be out in the field as well.
All right, anything else?
I got just a question, a comment, maybe on the mobile home tax thing. It seemed to me that the key organization there was the tag agent, right? So that if the tag agency's closed over this, then you guys will need to reassess how that part's done, right? But that's kind of the pivotal issue from what I've seen there, and until that happens, or if that.
Yeah, then we can reassess. I
Yeah.
mean, I'm pretty sure that we're probably gonna be reassessing things as things
Absolutely.
change daily.
Absolutely. Okay.
One other thing,
Yes,
I
ma'am.
have my big sale coming up in June, the June resale, which we're preparing for. All the title searches are done. There's been a lot of talk between the treasurers. Should we go ahead with publication? It's costly, very costly, $25,000, $30,000, $40,000 in publication if we don't get to have the sale. The state auditor's office emailed us today and said, continue business as normal, do your publication, do your certified mail, just like if we are still planning on having the sale. So we're gonna continue as normal. Even if we don't get to have the sale, we still met all of our criteria that we were supposed to do so that we could have it at a later date if we needed to. So we're gonna continue with everything that we need to do to have the June resale.
Thank you, ma'am.
All right. Anything else, Tish?
No, thank you.
All right. Cheryl, court clerk?
We received a SCAD from the Supreme Court on Monday afternoon, and in response to that, Judge Corley had issued an administrative order. Yesterday, we received it. He basically has set off all jury trials, all dockets. We will have daily arraignments. We will have in custody dockets that will be done via the telephone system. There will be no one in the courtroom except for inmates that, somebody who gets out of jail, gets picked up on something. That would be the only people in our courtroom. Everything else has been canceled, it has been rescheduled. We did put this on our Logan County website. It has when your docket was set, when it has been continued to, so that people can look on there, or they can go to OSCN. And OSCN actually has we have our records where you can look up yourself and see when you've been reset. We're in the process of putting court minutes in. But it also has any other counties around here as to what their judges are doing as to dockets and that kind of thing.
What about people that's called up for jury duty? Will we send out a notice, tell them not to
We
come?
have sent a notice to the ones, we had a jury docket starting April 6th. It has been canceled, of course. We had some people that have already gone online and contacted us, and we had dismissed them through the internet. Anyone that we did not get something from yesterday, we sent a letter that has excused them from jury duty. So there is no one set for jury duty at this time.
All right. Anything else?
And I believe the judges are going to request that only defendants, litigants, attorneys, and of course law enforcement be in the courtrooms. And the courtrooms are being cleaned by trustees in the evening. They go in every evening and fumigate the courtrooms so that we're not having to hire outside help to do it.
All right.
All right?
Troy, you got anything?
The nature of one side of my office is subject to a lot of foot traffic on the land records side, whether it's people doing research or bringing documents into file. I would suggest that we limit across the county public to 5 members at any one time in any one office. I don't think that we're right to close the doors. The public owns these buildings, they're theirs. I do want to make things more convenient for them, or them to feel more safe and confident to do their business with us. I would like to make that the standard, that no more than 5 in my office, between my vault, my public computers. We can keep distance, isn't going to be that big an issue. We quite often, people are excited when they buy a home or a property, and they want to share it with all the relatives, and they'll bring an excessive number in to file their documents. I'm like Cheryl, I think we should have a policy that says your direct business entry only. Not everyone needs to come into any of us, just take care of your business. The drop box out front, it looks like the old when we used to have mailboxes, just for everyone to know. I do think that if we all, for all county offices, lean to that drop box, if the public isn't comfortable coming into the building, if they are one of the groups that might be a little higher danger with this, they're welcome to leave their documents in that drop box. For any of us, we'll check it several times a day, recording. I think Cheryl and Sherry and I had already talked about kind of making that a practice. The only thing that we would ask is anything left in the drop box be placed in a sealed envelope, and it clearly labeled to what department or office it goes to, and that it has a contact name and phone number for any questions or anything regarding that. And I think that we should be pertinent enough if we have a customer that comes in and starts coughing all over everything, that we tell them to leave. You know, I don't know that any of us want the responsibility of trying to administer temperature taking at the public level. I don't know that the security deputies or anything. I think over panic is a bad thing. The custodial staff with the trustees are spraying and wiping routinely and regularly through the buildings. We've got more product on order, but the shortage in supply right now is extending even to us trying to get some orders in. We've got quite a bit of stuff on back order. That's kind of where we are.
Well, it's not listed on the agenda, but we have the election board here. Y'all got any input or any concerns?
The state contacted us yesterday, and our April election is coming up, and as of right now, we still have to be open for the April election. But we don't have a lot of people coming in right now.
Alrighty, also OSU extensions here, you got any concerns down there, Brandon?
We've canceled all of our external public events, all of our youth events, based on administration from OSU kind of giving us guidance. The campuses are shut down. Classes have gone to completely online probably until the end of the semester. So we're limiting practices and events to either cancel or postpone. And we have a lot of virtual meeting opportunities that exist for us. So the things that we would normally do face to face, we can do through Zoom or some other media, some other platform media. Our office is still open to the public. When I get done here, I'm going to go over to the health department because I'm pretty sure we share an air. The air comes across both offices, so I need to see what they're doing as far as what their personnel are using PPE-wise inside of their facility, so that we might mimic that. The only thing that we have as of now is that if the K County, as an example, they closed their courthouse to the public, and kept their people in there working. So our direction from administration is that if whatever our courthouse decides to do, we mimic that at the county office. So if the courthouse decides to close but keep employees working, then that's what we'll do. And besides taking soil samples and things like that go to the lab for analysis, we've really just kind of limited our interaction. So any youth or HCE, anything like that, anything extension related is postponed at least until the end of, till May 12th, really, is our date that we've set.
All right, thank you.
Monty, if I may, just to throw out there so everyone has it, Logan County spelled out OK.com is the county website. Each office have pages that have links to their direct records websites. County clerk, the assessor, the treasurer all have the records that you can access through there if you just need information. So that's the jump spot with that.
All right, David Ball, I gotta apologize to you, I just skipped right by
No,
you.
you're good, you're good. I would add, I did have a conversation with the Fair Board president, and they've canceled all events at the fairgrounds through May the 12th on CDC guidelines as well. And that's the only other property that I'm aware of that we would have any, besides the courthouse, have any responsibility on. But
You don't have no test kits?
I have 0 test kits, and I have 0 toilet paper. Yeah.
Whoa.
Yeah, I don't have any of that.
You got
And I
that.
just, been working, Damon and I have been texting and talking regularly, and Brandon and Jan, and we're in uncharted waters with this, and every day things keep changing. I would add, I was on the governor's conference call the other day, and one of the deals that they were hit on several times was there's not expecting grocery stores to close, so you still should be able to go. Now, the grocery stores may be limited on what they have available, but there's no expectation that you won't be able to go to the store and purchase something if you need it to. So.
Well, I'm assuming this coronavirus causes diarrhea because there's no toilet paper at the grocery store.
Yeah, I have no idea where that is. And I don't know if that's another deal, the state of emergency declaration. Do you want to talk about that now, or do we want to wait?
I think we've got that on item 3.
Yeah.
Okay, sorry.
Marvin,
I
you
think
got
all of that
anything?
falls under
Yes,
3.
sir. Other than we're business as usual. We're out fixing what roads we can with the resources we have.
Well, we've made a few changes, I'd say changes. Grader operators already report to their graders out there in the field, so there's very minimal contact. Of course, we're keeping 10 foot or more distancing between employees. Plus, my mechanic has his little heat gun that he has, and so even though temperatures are running about 92, 93, when we understand, there's a little distance in there, and it's not going to be the 98.6 yet, and still, if they are actually have a fever and don't realize it, we believe that we could pick that up and get them distance. So, of course, the rule has gone out, if you don't feel good, stay home.
If I may add two more things that Jan and Brandon have really hit on. CDC website and State Health Department. I mean, those are the two best places if people are wanting information on what's changing, because there's a lot of misinformation that's floating around.
We can give that shout out
Mm-hmm.
to the state's website, which is spelled out coronavirus.health.ok.gov. And the phone number is 877-215-8336.
Alrighty, we all good on that? Item two?
Commissioner, I just want to add something real
Sure.
quick. I'm going to put my fire and emergency medical services hat on here real quick because we have a very small number of ambulance services that run this entire county. And they are being completely and utterly bombarded by people that want to be taken to the hospital in an ambulance. So the Chief Harlow has requested that working through the dispatch, if they're able to get with their private care provider, then that's the route that they need to go. Don't call the ambulance for a fever, because that takes a lot of unnecessary resources and not enough to go around. The fire departments and EMS don't even have enough PPE to do all of that stuff. So I just wanted to let everybody know that. Use your private care providers as a first line, and immediate health risks, things like that, are still an ambulatory issue, but just because you think you have symptoms doesn't mean that the ambulance is the right transportation method for you.
Thank you. Item 3, consideration and possible action to establish protocols to be in place responding to the coronavirus.
We've drawn up the emergency proclamation. This was a derivative of several that I had seen, just basically enforcing what the president and the governor have done. It's been sent to all, to the three of you. In light of backing that up and today's discussion, I think you all could take action on a resolution to put together the exact what we are and what we aren't going to do based on what we saw in here today. To do that effectively, we would, I would suggest that you do the proclamation now, maybe go into a recess if you want to come back in and do a resolution so it was in place today based on what we heard today. That would be up to you all. Otherwise, here's the proclamation.
Would you like to read it?
I can.
Thank you.
Whereas on March 18th, 2020 and continuing, COVID-19, aka coronavirus, continues to spread and potentially threaten the citizens and residents of Logan County, causing known illness and potential fatalities. And whereas President Donald J. Trump declared a national emergency and the governor of Oklahoma, J. Kevin Stitt, declared an emergency in all 77 counties. And whereas we, the Logan County Board of County Commissioners, do find that the aforementioned conditions constitute a threat to the safety and welfare of Logan County and create an emergency situation within the meaning of Section 683.3 Oklahoma Emergency Management Act of 2003, as amended, do hereby declare Logan County to be in a state of emergency entitled to aid, relief, and assistance. Whereas this proclamation to remain in effect until April 15th, 2020, dated this 18th day of March, 2020.
Thank you. Any questions? Comments?
I move to approve the resolution.
Second.
I have a motion and a second. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye. All opposed, motion carries.
Do you all want a resolution detailing anything done or not?
I think we're just good with the discussion we've had, but that's just my personal opinion.
I agree.